I never thought I'd need to give my 9-year-old medical cannabis. Here's how we got here. So this story's not new. It's been told repeatedly for years, but we must keep telling it to remind those, especially those who use cannabis, that it's not just about the high. Most parents are trying to keep their children away from cannabis. Do you know any 9-year-olds on cannabis? I didn't until recently. It was something I never expected, just like much of my current life. But it wasn't a stretch to try anything to help out our daughter. When my daughter was less than a year old, I sat on a hard plastic chair at our local children's hospital as the doctor told my husband Cedar and I that she had a rare genetic deletion, so rare that it had no name. Our beautiful girl was missing DNA, unfortunately, a lot of it. Under the harsh fluorescent lights, the geneticists explained that our child's future was largely unknown. There were too few people with her condition to know how the genetic difference would affect her, but it will likely be a significant impact. Reality began to seem more like a dream as the doctor revealed that our child might not walk, talk, or eat by mouth, and could experience any number of medical issues, including a major heart problem or progressive hearing loss, along with the moderate to severe developmental delays and behavioral changes. Witnessing my beautiful, bright-eyed daughter suffer was and still is the most excruciating thing that I have ever faced. I stumbled through the various permutations of grief, a lot of crying alone in the car, self-blaming and comparing myself to other mothers, the kind of mothers I thought I would be. These mothers considered everyday parenting questions like, how much Halloween candy to allow? Meanwhile, my child wouldn't eat much of anything. We first tried medical cannabis when our daughter was 5 years old, during the height of the pandemic. Most parents were trying to keep their children away from cannabis. That is certainly our perspective for our older child, but it wasn't a stretch for us to try anything to help our daughter. I knew that medical cannabis was sometimes prescribed, so my husband and I asked our daughter's psychiatrist. Eventually, we were referred to a neurologist who provided information and answered our long list of questions. I also poured through research studies on the subject because there was a reasonable chance that medical cannabis would help with our daughter's ongoing discomfort, nausea, and most of all, aggression and self-injurious behavior. My husband and I agreed we needed to try it. With the expertise of a skilled pharmacist at a nearby medical dispensary, we landed on a small dose of a tincture with a little THC. We administered a liquid through a feeding tube, which is where our daughter gets all of her medicines. We plan to try other formulations with different combinations of THC and CBD if it's not effective. I haven't yet faced judgment about the choice to try medical cannabis. I've been open about what we've been through with those who we are close to. My people have a sense of how hard my husband and I work to help our daughter. This is not about getting her high, and they know we don't take a decision like this lightly. I've heard plenty of jokes lately too, such as, maybe you adults are the ones who need weed. What I really need, most of all, is a miracle cure to take away my daughter's suffering. Short of that, I need to feel hope, which includes access to innovative treatments. After reading this story, I must admit, I'm not worried about rescheduling, putting limitations on cannabis. I'm happy that cannabis will be rescheduled, where more research might lead to better cannabis products for those like this little girl who are suffering. It's an old and ongoing story that needs to be retold. For many who are suffering, it's not about the high. And anyway, the weed at dispensaries is not great. It's old, dried, and packaged. I prefer it fresh and straight from the farmer. If you had to go back to the trap so that those who are suffering would have access to better research, would you? This is Dr. Jean Talleyrand with High at 9 News.
Man, Dr. T, this is a super, super sad story. And I just want to, my heart goes out to all parents that are experiencing anything like this with a child. I know it can be totally devastating. I know we've helped a number of different families over the years. with similar situations like this, and I've witnessed a number of children really truly benefit from cannabis, not getting high or anything, but truly medically, like serious benefits, as far as kids that are having seizures and whatnot that were uncontrollable until they were able to start ingesting cannabis and whatnot. So it truly is a miracle in that sense that it's able to provide those children relief. But I think Dr. T, in your final statements, I heard you endorse the trap, if I'm not mistaken.
Was that the first,
I had to go to the trap
endorsement of the trap we had on the show?
That is the first medical endorsement of the trap that I've heard.
Thank you.
You mean I haven't endorsed a trap prior?
Well, you have endorsed crossfading.
Yes.
Yeah. Hey, feel free to do what you need to enjoy this life. That's for sure.
Yeah.
Doctors, they're just like us.
Mm-hmm. Exactly. They like trap weed too.
Yes.
Not mad at that.
Yeah, I mean, currently the industry is not producing great flower anyway. So
You're correct.
in California anyway, most people are going to their neighbors.
Yep. That's very, very, very true. So true. Dr. Mark, do you have any thoughts on this from your medical expertise? Any experience with children?
Well, the only experience that I have is actually seeing how fast CBD helps an epileptic patient. Mm-hmm. I've seen a girl who has Germain syndrome, which is intractable epilepsy.
Yep.
And so her mom had some CBD oil and administered a rescue dose during the middle of what began as a grand mal seizure, right, John? So that's basically where, the kid is completely losing bowel control. Her tongue would swell up, so she couldn't breathe. So often what would happen is she would actually start turning blue because I guess her brain is starting from oxygen.
Wow.
So I've seen, basically a patient in full-blown seizure stop seizuring after getting CBD delivered orally in a tincture. I'd never seen anything quite like that before. I don't know, maybe Jean's got more experience with that. I haven't really seen, I know that other pediatric disorders, the one that Meshulam always talked about was chemotherapy-induced nausea in children, and that a sub-psychoactive dose of THC under the tongue, just in an olive oil vehicle, so just an olive oil tincture, completely blocked all nausea associated with chemotherapy. And this is, again, so the kids aren't high from that. They're not getting enough THC. THC dose is so small, and they get complete block of chemotherapy-induced nausea.
Yeah,
Yeah, I mean, I'll just say anecdotally that I know kids who, again, are maybe a little on the spectrum side of things. They don't really fully diagnose exactly what is wrong with some of the kids. And CBD does appear to calm them down, so they get basically the anti-anxiety effect from CBD. But other than those examples there, I don't really have any practical experience with treating childhood disease with cannabinoids. John's probably more experience.
So I used to go up to Canada, and I used to meet the good people over at the Green Cross Society of British Columbia back in the day. So shout out to all of those guys that are up there. And I was introduced to this doctor, Dr. Hornby. He has since passed, but he was like Canada's #1 researcher when it comes to cannabis and whatnot.
And he worked with Johnny B, right?
Yeah. Yeah. That's I know John a fellow from all those conversations as well, and he was treating a young girl, maybe 8 or 9 years old, that had Gervais syndrome as well, and the started treating with cannabis, and all of a sudden the seizure stopped, to where the mom would start freaking out in the middle of the night because she had always been woken up by seizures, and then once the treatment started, she would still wake up in the middle of the night, but she would wake up in a panic because she hadn't been woken up to any seizures yet. And so it's such a psychological shift for, and Mathieu St. Germain, maybe you can touch on this. You have your son is not in the best health at the moment. Can you touch on what it is for parents when they have a sick child that...
Oh, it's the absolute worst. I mean, you have something outside of yourself that you care for more than yourself that you can't really personally influence. You can just coach and cajole and do your best for. I mean, it's a deep, dark well. I would like to say that we've been doing a 10-to-1 CBD to THC Simpson oil for Kai. At night, there is some efficacy shown, some neuroprotective effects of cannabinoids, and also just helps him sleep without, his head hitting the pillow and worrying about the next. A lot of medical efficacy in cannabis in our family as well as in the greater community.
Yeah.
How are you dosing that?
It's in a syringe. My friend makes it from all organic products, and we give him about a size of a grain of rice. I forgot the exact milligrams. We've just about a size of a grain of rice is enough that he doesn't feel it when he wakes up. Any more than that, and he has a little bit of he'll have a little
groggy.
Yeah, we want to keep his brain, fresh and active. He gets up in the morning. He does bright light therapy, red light therapy, some exercise and meditation stuff. He's just full on, so we want to make sure he can wake up and pop up and get right to all of his health regimen.
Yeah. Any thoughts on this, Rachelle, before we move?
I just want to say I'm a huge proponent of pediatric patients, an advocate for them. My nephew is 9 and he's nonverbal autistic, and we've been dosing him with CBD, and it's been really effective. His outbursts have gone down, his self-injurious behaviors have gone down. He's very picky. He has a lot of sensitivities with different foods and stuff. So we literally just put water soluble drops into his water, and he drinks that. He doesn't seem to notice it's been dosed. And it really seems to help. And I'm just really happy that we have access to that medicine for him and for others.
Facts. And on that, I know Rico feels the same way. We want to make sure that we are sending all of our thoughts and prayers to all of the families across the country that are experiencing some type of sickness with their child. And hopefully cannabis can help that.